Hi, everyone. Thank you for sticking around. I appreciate it. I'm going to share my screen quickly. Okay. Hi, I'm Videsha Joshi. I'm the New Jersey Breastfeeding Strategic Plan Associate at the Central Jersey Family Health Consortium. And I'm joined by my wonderful colleague, Denise Miranda, who is the co-chair of the New Jersey Breastfeeding Coalition's Childcare Committee.
Good
Uh, we're
morning.
going to talk We're going to talk to you a little bit today about the breastfeeding friendly childcare initiative that we've been working on for several months. Um, but before we kind of go into that, just to kind of give a sense of where this came from, I want to talk to you a little bit about the breastfeeding strategic plan. So this plan is a roadmap of goals and objectives related to policy and education initiatives for us to really improve lactation support around the state and try to normalize breastfeeding as much as possible. There's actually eight areas we've kind of condensed into this graphic. So we cover parents, families, and communities, healthcare, research and surveillance, employment and childcare, public health infrastructure policy legislation, and emergency preparedness and public health crisis as well. So just to kind of give a sense of why we think breastfeeding is worth normalizing, many of you probably already know this, but some of breast milk is pretty incredible. It's human milk that's custom made, first food for babies. It benefits mothers by reducing their risk of breast and ovarian cancer, hypertension, type 2 diabetes, cardiovascular risk. And it's for these reasons that we really feel like breastfeeding is a maternal health issue and a public health issue, and needs support in all public and private settings. So our specific goal around breastfeeding friendly childcare involves ensuring that licensed and registered childcare providers serving infants and toddlers accommodate the needs of breastfeeding and lactating parents in New Jersey. As you all know, the Office of Licensing already has childcare requirements that discuss breastfeeding related policies and procedures. We're looking to actually expand on those recommendations and those requirements. So our goal is to work with the Office of Licensing to explore adoption of regulations that require implementation of policies and lactation support competencies. So to require that for licensed childcare providers and registered family childcare homes. Um, and to my colleague Denise, I'm going to hand the mic over to her. She's going to go over some of our more specific work.
Good morning, everyone. Thank you for sticking around. So why do we encourage childcare centers to support breastfeeding families? For one, there are many health benefits for both the mom and the baby. Breastfed babies are shown to be less prone to sickness, which then leads to a healthier classroom and healthier staff. Um, your families are also able to achieve their breastfeeding goals. That transition between staying home with the babies and starting their breastfeeding journey to now having to go back to work 2, 3 months later, you guys are the that in between to help them reach their breastfeeding goals and then continue once they return back to work. So some of the things that we do want to start seeing and is in our breastfeeding friendly childcare training is that we want to have a private and comfortable space for mothers to feed on site. The staff to have to know what the proper human milk storage and handling procedures are. Um, we want a big breastfeeding friendly signage on display. And then to have all staff to be trained, which is now on the NJCCIS. We have it both in English and in Spanish. It is an hour-long training, and we have about 5 modules to break it down on how you can get there. Um, we also want an orientation and annually thereafter on breastfeeding and policies and competencies. And then we also want unused breast milk to be returned back to the families at the end of the day. In our training, we have a toolkit that provides a lot of the um, help that can get you to where you need to be breastfeeding friendly. So we have the training becoming a breastfeeding friendly childcare, which is again is 1 hour. We also had created a 10 steps to breastfeeding childcare center to break it down. We have a self assessment tool. And then we also have a model policy. Um, and then we have our booklet that the training had came from, which is called The Breastfeeding Babies Are Welcome Here. Um, and then we also have a breastfeeding friendly welcome here sign for you to put up once everything is all done. And Videsha, this is the survey that we are looking for, correct?
Yeah, yeah. Did you want me to go over
Yeah.
that? Okay, sure. So I just want to actually go back to this slide. So this QR code here
Oh,
will
yes.
take you directly to the toolkit. So please
Mhm.
use it. Cindy did mention that this information will be shared in a recap email. So we'll be sure to make sure that that QR code is available to all of you. And then this QR code is actually to take you to a survey to kind of get feedback from you on what is already happening at your centers pertaining to sort of the accommodations that are in place for staff and for families. We're sending this out to employers as well. We're really just trying to get a sense of the landscape of what's already happening. So if you're able to fill out the survey, it would greatly help us to better understand what's out there. Um, we went through it very quickly. I know that we're short on time. If there's any questions, I don't know if we have time for questions, or you can always email us. Our information is here. Um, but we really wanted to just kind of give everyone a sense of what we're working on and what we feel and what we've heard from meetings that we've had with Grow NJ Kids and with Rutgers and different CCR&Rs with Prevent Child Abuse New Jersey, that these breastfeeding friendly policies are happening in many ways and in many places across the state. So formalizing them in a way that's required seems like a really good next step. So if you're able to fill out the survey or if you want to just give us feedback in general, please feel free to contact us. Thank you for your time.